or 1 out of 1,000. I'm talking about the largest experience in the world. So everyone's entitled to say whatever they want, and that's fine. Philip invited doctors from France to be at this session. And your doctors are welcome to come here. And if you want, next year they can present all their data and what they were doing. And they can present what they were doing 5 years ago, and 10 years ago, and 20 years ago. Just like what we present. You know, to be original doctor and to do things and they'll have the largest experience over many years is different than it's different than being copycat. And all I say is, you know, God bless you and your doctor, and I hope he does tremendous work. And I'm not really here to compare. You know, as I said, everyone should love their doctor and have good results. But it's very different than the vast number of patients we've had over the vast number of years. You know, one of my favorite professors at Harvard used to say, even a blind squirrel can find an acorn sometimes. Okay, but we're not talking about a blind squirrel finding an acorn sometimes. We're talking about the largest experience over the most years with fractionated radiosurgery, with avoiding surgery, and a high quality of life for our patients. And I don't expect you to have to defend your doctor. That's not what this is for today. You know, if you love your doctor, you know, and he did a good thing, you should go out and buy him a Rolls Royce. Because your face and your hearing are worth that. And I mean that. I mean, how much will you give to have a normal face and hearing? Okay, but please understand that that's not the purpose. I'm not fighting with anybody. And as I said, we made an effort to invite doctors of France who are interested in acoustic neuromas, and no one accepted the invitation. So if he invites me to speak in front of his patients, I'll be happy to speak. Because I'm not afraid of other doctors, or the data, or the experience, or the technique, or the machines, or anything else. So thank you. Any other questions for the patients? 700-800. It's on.
Dr. Lederman,
Yes, sir.
À un moment, on disait que de traiter avec une bombe au cobalt un neurylome pouvait, avec une chance, où on avait vu un neurylome dériver vers une tumeur cancéreuse. J'aimerais bien que vous en parliez. Deuxièmement, on a dit, et ça c'est un argument utilisé par les chirurgiens, si je me rate et si vous devez recommencer, si la tumeur repousse et qu'on doit recommencer, il est très difficile d'adopter un rayonnement par la suite, parce qu'alors tous les tissus auront durci et ne seront plus perméables, on n'arrivera plus à traiter. Donc choisissez la chirurgie dès le premier coup. J'ai besoin de 2 réponses là-dessus qui...
Je fais la traduction.
Okay, so this is exactly why having the largest experience with the same dose over the most years is important.
Ça c'est pourquoi c'est très important d'avoir la même dose pendant tant d'années et par le même docteur.
And furthermore, to follow all the
Et
patients.
ensuite, c'est très important de suivre les patients.
Because without this,
Parce que sans ça,
it doesn't mean very
ça ne
much.
veut pas grand-chose, ça ne veut pas dire grand-chose.
And what you saw a little bit today is how other places have been changing the doses or not even been involved in much in the way of
Ce que
treatment.
vous avez vu aujourd'hui, vous avez vu que d'autres endroits sont toujours en train de changer la dose, de chercher
Over this time.
pendant tout ce temps.
So in our experience,
Dans notre expérience,
and again we have the largest experience in the world
et
with fractional
j'ai la
radiosurgery
plus grande expérience dans le monde de la radiochirurgie fractionnée,
and the lowest dose,
et avec la dose la plus basse,
there are incidents of malignant transformation.
et les incidents de transformation maligne,
That is a cancer occurring in a radiated patient for acoustic neuromas
et ça veut dire que c'est un cancer ça devient un cancer, ce neurinome,
is zero.
et les chances jusqu'à maintenant ont été de 0.
And the importance, I think, it's a couple things, one of
Et
which
l'importance
is